Ozone is one of the most misunderstood therapies in integrative oncology. And when it comes to prostate cancer, it's not as simple as people think. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. Ozone therapy is not a traditional therapy or cure to cancer, but it is something that I might include in broader circumstances in a more personalized plan. Ozone therapy is hyperactivated oxygen, I like to say. So what it is oxygen is 2 oxygen molecules put together, and ozone is 3 oxygen molecules together, which makes it actually a completely different substance. Just to help you understand that a little bit, is like water is H2O, right? We have 1 oxygen molecule and 2 hydrogen molecules. Obviously, it's a completely different substance when those hydrogen bonds are bound to oxygen. And it also has anti-cancer action. And what it does is it increases reactive oxygen species inside the cancer cell. And these reactive oxygen species then damage the cancer cell, and the cancer cell undergoes apoptosis. So I would use ozone in a prostate cancer patient if someone has a chronic infection. So if they have like chronic Epstein-Barr virus, Mycoplasma pneumoniae, chronic strep, chronic staph infection, I'm going to be using ozone therapy to go after that, because it's going to kill the infection, but it's also then going to be good at killing off the prostate cancer itself. I would not use this therapy in someone that has a G6PD deficiency. This is a test I always check if I'm doing oxidative therapies like ozone. So if they have that deficiency, they're not going to be able to regulate the oxidative stress that happens with ozone therapy. It can cause harm to the body. So I'm not going to use it in someone in this situation. So let's talk about what ozone therapy looks like. So ozone is a gas. So how do we actually get into the body? So how I do it is we do IV ozone. So what we do is we draw a little bit of your blood out and we place that in a bag, and then we ozonate the blood. This is called major autohemotherapy. Sometimes I also do is I infuse ozone into a sodium chloride bag, and I ozonate the water, and we could ozonate the body through ozonated water also via IV. There's another form we can do is we could do insufflations, like a rectal insufflation, and goes right into the rectum there, and it infuses ozone throughout the body through that pathway. Yeah, so ozone's going to be great for someone that they know they have a chronic infection. This is for someone that wants to use the oxidative component of killing cancer cells that way, and also wants to kill off the infection. So that's what's going to work best for them. But you also need to know if ozone is actually right for you. Like we talked about, we need to do a lab test and actually see if you have a G6PD deficiency. We need to see if you actually have chronic infections, see if it's actually warranted for you to do the therapy is different. So you need to go to integrative oncologists as an understanding of ozone to really have the best effect if you have prostate cancer. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. If you're interested in ozone and setting up an appointment with me, you can click the link below to see if we are a good fit.